I'm Dr. Pradeep Mahajan from StemRx Bioscience Solutions, a pioneer company in biotechnology works, particularly working on autologous stem cell technologies. Today I'm going to talk to you particularly on joint aspects or orthopedic conditions. How do we look into a big aging problem that is called as a silver age population, where people are waiting in queue because of their joint pains and hip pains and knee joint pains and shoulder pains, like frozen shoulders, arthritis of the knee, hip joint, or avascular necrosis. Looking at those conditions today, the only treatment of choice for these conditions is a joint replacement surgeries. But joint replacement surgeries have got a small span of life of 10 to 12 years. And also ergonomic life of the patient is compromised. Their day-to-day life movements are painful. Joints become swollen up. Patient in day-to-day practice of ADL, that's activities for daily living, it becomes a mess up situation for the patient. For even walking for a short distance, even sitting or getting up or sitting for a long time, it's a painful situation. And this makes you immobile. And when you become immobile, life becomes crippled and disease oriented. Now, having a joint replacement surgery is not a solution because we lose the original joints. When you lose the original joint, their lifespans of the joints are 10 years. Now, having known that joint is a part of bone and bone marrow are the integral part of one organ. When you get a fracture injury, these fractures are healed up without doing any manipulation by the bone marrow. Now here the concept is that how do we repair the damaged joint using the same bone marrow which repairs the fracture? Now it's a very synonymy, very close to understand. This synonymy explains you the same bone marrow could be used to repair the cartilage, to repair the menisci, to repair the ligaments, to repair the inflamed swellings around the joint, and see that the same joint works for the lifetime. Particularly the population which is 50 plus, 60 plus, which has got a lot of morbid conditions like diabetes, hypertension, heart problem, depression problems, or degenerative problems of the brain. Surgery is a high mortality and high risk subject. And if the same joint of this patient or this person, same joint for the lifetime, second, no pain and full range of movements. If we can achieve using his own cells, where I call this technology, you have your own repairing tools in your own body. Use them to repair the joint and you can come out of a big problem of joint replacement surgery. Even the stage 1, stage 2, stage 3, stage 4. It's the only patient selection, right diagnosis and right therapeutic approach of using the stem cells to repair these cartilages or ligaments or ligament tears which are there, ACL and posterior ligament or anterior ligament tear could be repaired and same joint we can preserve. This hope is just not a hope, but it is a reality because these bone marrow cells are already doing repairing jobs of fracture in your body. So let's convert these repairing system into therapeutic applications. So my theory of this is going to give you the same joint to maintain in your life for the lifetime. So let's have a thoughtful process on this. Can we save our joints? A big wave of this, what you can say, large number of patients which are increasing because the age is increasing, we can save their joints and that too lifetime. So anybody has a question to discuss on this, they can always communicate me on 8898070904 or email me on drpvmahajan@gmail.com or drpvmahajan@stemrx.in. That will give me a good knowledge to explain you again. Thank you.